2,500 Australians are diagnosed with lymphoma each year. That's 11 people every single day. Almost as many Australians killed in car accidents each year die of lymphoma. It is this country's fastest growing and fifth most prevalent cancer, yet awareness of this disease remains unbelievably low.
To shed some light on lymphoma, we're joined by Peter MacCallum Cancer Institute expert, Dr. Max Wolfe, and lymphoma sufferer, Jodie Guerrero. Sorry, Jodie, if I've messed that up. Who's in remission, but who's still fighting the disease. Thanks both for coming in.
Good morning.
Good morning.
Jodie, when did you start feeling unwell?
It happened in November 2005 when I was finishing breastfeeding my young baby, and I found a lump in my right breast. And at that point I was very exhausted, but didn't realise how exhausted I was. Thought it was just from being a busy mum.
Or maybe a blocked milk duct?
Yeah, something like that. So I arranged to go to a breast clinic, and the breast clinic basically said come back in 6 months. After that I was referred back to my GP, and the GP didn't do anything at that stage. After that I started to get more symptoms, and towards the end of an 11-month period before I was diagnosed, I started to get back pain, severe back pain, and started to even not be able to sit properly, even at work, in my office chair, in the train. And I was in so much pain towards the end, I decided I have to go to the emergency ward because no one was kind of helping me out. So I went to the emergency ward and we did a CAT scan, and that's when we found it. And I had very extensive disease. I was terribly sick, and I'm glad we found it when we did because I'm lucky to be alive.
And they diagnosed lymphoma?
They did. Non-Hodgkin's lymphoma, and it was stage 4, which is the last stage.
Right.
All right, Max, we probably should bring you in here. What is lymphoma? What's the difference between non-Hodgkin's and Hodgkin's lymphoma?
Lymphoma is a generic term including both non-Hodgkin's and Hodgkin's lymphoma. Non-Hodgkin's lymphoma is far more common. There are a number of differences, including the appearance under the microscope, the way it presents and its prognosis. But non-Hodgkin's lymphoma is probably 5 or 6 times more common than Hodgkin's. So of the 3,500 cases, about 2,500 are non-Hodgkin's lymphoma.
What causes it?
Oh, well, that's a good question. We don't know what causes it. We know it's increasing in incidence, and it's become the 5th most common cancer in Australia. It's increasing in incidence in all the Western countries. Australia has one of the highest incidence, similar to the US or Europe. Most of the developed countries are at that level. It's clearly environmental, but probably something to do with the use of pesticides and other sort of additives and so on, but we basically don't know what causes it.
Because it's a blood cancer, isn't it?
It's a blood cancer. It's a lymphoid cancer. It's a cancer of the lymphoid tissue in the body, the lymph glands, and other lymphatic tissues.
It would seem to me that since it took 11 months for you to discover what was it, have you even gone to a breast
clinic? Because there was a lump in my right breast. Right.
It would seem to me that very little is known about it, even amongst professionals. Would that be right?
Yeah, that's right.
Well, apart from hopefully people actually looking after lymphoma patients, yes, although it's becoming common, it's still not as common as the other common cancers like breast or prostate or bowel, but there is clearly a need for greater awareness both in the general public and in the general practice and medical community.
Jodie, what did they say to you about your prognosis?
Well, my prognosis is really reflective of the statistics of this disease, and they basically say that I'm incurable because I got to stage 4. However, I have a lot of hope and a lot of faith that maybe one day I will be cured, and I'm actually even saying that now. You know, I'm just
believing. You're in remission, aren't you?
That's right. I've been in remission since March, and I'm very happy about that. And my last PET scan on Thursday was completely clear.
That's fantastic news.
Yes, it is fantastic.
You look extraordinarily well, too.
Thank you, and I feel good. I feel fantastic. For the first time in a long time, I feel great.
But as I understand it, you're still continuing treatment.
That's
is that right?
Correct, yes. As part of beating this disease, I'm basically doing maintenance therapy every 3 months for the next 2 years, which is a specific drug that they give me via IV in the cancer ward, which will help me keep in remission.
Max, I was reading about the symptoms, which include swollen glands, lack of energy, weight loss, fever, night sweats, itching. That could be anything.
Swollen glands are by far the most common, but it can present in very obscure ways, and such as just feeling tired or getting a few night sweats or an itch. So, as you say, it could be virtually anything, and that's why.
So, given that it could be anything, how do you encourage people to go and get checked out? I mean,
well, clearly, swollen glands should ring some alarm bells.
No, but that was me on Thursday, though. I mean, but seriously, it's such a general symptoms.
I think from my perspective that people who have lymph glands enlarged more than a month should really, really push and ask for a test to clear out lymphoma, to make sure it's not lymphoma. Because what I was told when I was in the hospital is after a month, if your lymph glands are still enlarged, you really need to have a test for lymphoma. And I think a lot of professionals, medical professionals, don't understand some of the symptoms for lymphoma.
So that was the lump under your arm,
Yes,
is that right?
It was an enlarged lymph node, and my lymph nodes were enlarged for 11 months before it was found. And I was in so much agony when I went to the emergency room. I couldn't even do anything normally anymore. And I had a massive tumour in the base of my spine that was eating into my spine. And that's how extensive the disease was. And I had to have emergency radiotherapy to save the function of my right leg. And I just went through a lot. But I'm so glad to be on the other side, absolutely.
Is there a most at-risk group category?
No, it can affect anybody from childhood, from even very young children can get it, to very old people. But so it can occur at any age.
Genetic at all?
There is some hereditary basis, but it's not inherited directly. So I would say that Jodie's children should not have any greater risk of getting lymphoma than anyone else.
You said before that genetic factors are undoubtedly influence it. What sort of environmental factors? What sort of environmental things? We're talking pesticides. Are we talking?
Yes. Well, there just needs to be more studies done into the environmental factors. There have been studies looking at pesticides, and people who are exposed to pesticides, for example, seem to have about double the incidence of lymphoma as people who are not.
And pharmacists as well.
Yes.
Really? Pharmacists, yeah.
There are other factors involved which we simply don't know. There could be dietary factors, but we don't know a lot of these.
And what about treatment? How do you then go about trying to cure the incurable or the inoperable in some cases?
Well, lymphoma is not treated with surgery. That's not an option. But
not even for the big tumours not even for tumours that
well, very little. Surgery has a very small role to play in lymphoma treatment, except in diagnosis to take a biopsy. But we've made great advances in the treatment of lymphoma, even though we don't know what causes it. So, like Jodie, we can get people into remission, and we can cure a large proportion of people with lymphoma. It depends on the type, stage, and so on as to the rate of curability.
Why do you think your treatment has been so successful? Is it a positive attitude? Is it a support network?
Yeah, absolutely. I have a website, jodiesjourney.com, and that tells my whole story. My support team was my church and my workplace, who kept my job open the whole time and allowed me to go back, and that's Boeing Australia.
I was going to say, let's give them a big applause. Because Boeing Australia were fantastic to you, weren't they?
They kept my job open, they paid me the whole time, and now I've been back at work 6 weeks and I'm just loving it.
Oh, that's marvellous. And I understand that your husband's work has been very supportive as well.
Yes, my husband's work's been fantastic. They made meals for us when I was sick. When I needed some housekeeping, they helped out with the housekeeping. And
what does that mean? How does that make you feel?
Everything. You just, when you're going through cancer and lymphoma, you just feel like you're in your own little place. You're not sure who really understands what's going on. And so having people around you who pray for you, who love you, who call you, tell you how much they love you and appreciate you, it's just everything. It just makes you feel like you're not alone.
Well, you certainly weren't alone. You had little people around you.
Yeah, I had 2 little ones.
Yeah.
My 6-year-old's autistic, so she didn't quite understand what was going on, but the 3-year-old kind of knew that Mummy had tubes, I had a Hickman's catheter for 9 months.
And you should explain what that is.
A Hickman's catheter is basically a device that's put into your chest so that you can have your bloods removed and then you can have medicines put through it, so there's no needle pricks in your arm. And that's important because you're having so much medicine and so much blood taken
You end
out.
up just with bruised arms, don't
exactly.
you? After all
Yeah.
that?
So, I mean, the Hickman's catheter was there for 9 months, and that was during my whole treatment. At the end, I also had 2 stem cell harvests. So they took 2 lots of stem cells from me.
All right, because if Jodie slips back into or slips out of remission, from what I've been reading, the next step for her is bone marrow transplant. Is that right?
It would be certainly a very important part of the treatment next time around. It depends a little bit on how soon that happens and what the stage and extent is, but certainly a stem cell transplant would be an important part of a treatment next time.
Max, are there many incidents of cluster lymphoma? I asked the question because I had a friend, had lymphoma, played in high-grade football, and a number of the people in his football team from some years back had the same thing.
Well, it could be coincidental. I don't know if that's a real thing or not.
Right.
We never know what
we all, I mean, I see that as well, but is it real or not? It's pretty hard to know.
Yeah. Where is research at? What angle? You've been pursuing lymphoma
For a long time.
For a long time. Have we made real advances? Is enough money being spent on research in this?
Well, there's never enough money in research, but there have been major advances in lymphoma research and lymphoma treatment, both at the basic laboratory level and then moving that into the clinic. In Australia, we are really actively participating in lymphoma research, basic research, better understanding of lymphoma, and also on the clinical side we have a group called the ALLG, which is the Australasian Leukemia and Lymphoma Group, which includes all the major centres within this country. All the doctors involved in lymphoma treatment are involved in that group, and we do clinical trials, basic research into this disease.
Look, it's really great to talk to you both, and I know, Jodie, you've got your own little cheer squad at home. He'll be cheering you on every step of the way. It's great to hear you in remission as well.
Thank
All
you.
the best.
Thanks for having us.
Thank you for your time this morning.
Thank you, and we'll be back with more of 9 a.m. right after this.
Country's fastest growing